go as I read the screens. We have Tom Keegan, we have Lisa Shanahan, we have Dominique Johnson, George Serenides, and then we have David Huvelman, who is not on the committee but attendance tonight. David, thank you for joining us. We'll go right into the approval of the minutes of May 28th, 2020. Would anybody like to move that?
I'll move it.
George is the loudest. We'll have him. Any discussion on that? Any corrections, deletions, omissions? All right. All in favor of moving the minutes? Looks to be unanimous. Thank you. Do we have anybody from the public?
I don't see anyone. It doesn't appear to be.
Hey, everyone.
We'll let the record show that Manny is in attendance. Manny Langella. All right, so let's move right into it. New business, fire department. Authorize the mayor, Harry W. Rilling, to execute an agreement on behalf of the fire department to Seagrave Fire Apparatus LLC for the purchase of 100-foot-long ladder truck, not to exceed $1,350,000. Account number noted. Discussion.
Well, I'll move it.
Thank you.
What do we have? Deputy Chief Chris King? Yeah.
Yep. Assistant Chief King, Chris.
Anything? I mean, it seems pretty straightforward, but is there any discussion items, questions around the item?
This isn't replacing the current one we have, right? We're adding another?
No, it's going to replace one that is going on 20-year lifespan.
Oh, it is. Okay.
Yeah, the trucks normally get 15 years frontline, and then we put them in reserve for 10. So it's going to retire a reserve piece that is going on 25 years old, and it's going to replace the one in Broad River right now, truck one.
Can we take it for a drive once you get it?
Probably arrange a ride in it, maybe not a drive, but you know, we can make things happen.
Does this include the upfit for all the equipment that you need, or is that
it
separate?
has certain equipment in there, and some of it's going to be transferred from the one that's being replaced, and some is normal.
Okay. What do you do with the old when you retire the vehicle?
A lot of times we'll put them out for either auction, and if nobody takes it, then it goes on to city surplus, and it goes out for auction. Usually the one that's replacing is quite old and has been quite useful in workhorse. I don't know how much useful life is left to it. A lot of times small volunteer companies down south pick them up and they refurb them up.
Makes sense. Thank you. Any other discussion on the item? All right, we have a motion on the floor. All in favor? Looks to be unanimous. Thank you.
Thank you.
You can hop off if you want, continue on, whatever, whatever you feel.
I'll stick around for a few more minutes.
All right. We'll move on to Police Department, item 2A and 2B. Authorize the mayor, Harry W. Rilling, to execute an agreement with Motorola Solutions, Inc. for the supply, installation, and service of radio system dispatch console equipment for the police and fire radio system. Pricing as per state of Connecticut master contract number A-99-001 and number 967-A-23-0338C for an amount not to exceed $895,184 from an account noted, and the remainder from secondary account noted. 2B, authorize the Chief Thomas Kohalik to execute change orders to the above agreement for the amount not to exceed $32,743. Accounts noted. Would anyone like to move the item? Mr. Keegan, thank you. Discussion.
Very
All right.
This is part of the upgrade we've already spoken about, correct?
Yes.
Yeah, so this is kind of a piece of the radio project. This is the consoles within dispatch. The equipment there is pretty well obsolete at this point, and this upgrade will move us into the new system.
I know we've been looking forward to this for a long time, especially with the new system we're going to be using. So,
All right. Any other questions, discussions? All right. So we have a motion on the floor. All in favor? And it looks to be unanimous. Thank you. That was,
Thank
we
you.
moved 2A and 2B together. Okay, was that a fair statement, Mr. Keegan? Okay, so the vote was on both. So we're all set here. So we could actually just move on to old business, which is the COVID-19 updates. Who's taking that one?
So
Yeah.
I'll give an
I'm ready.
update, and then I'm hoping Michelle will also be able to give an update as well. So Michelle, you want me to go first?
Yes, please.
Okay. So we continue to see a real downward trend and a slowdown in cases in Norwalk and the state of Connecticut. We're also just paying very close attention to what's going on in other areas of the country. You know, we're seeing a lot of increases in the South and also in the West. And but we're really pleased and feel so fortunate to see the positive changes that are happening in Connecticut and the surrounding states. And so just want to take a moment to thank everyone, to thank all the community members, the businesses, the organizations, you as leaders, as elected officials in the city, the mayor, of course, for his great leadership, and so many others. I mean, we're just so fortunate to have such strong, you know, elected officials, both locally, state, nationally representing us, to just really just be true public health advocates and just setting the tone for our community. And so, I mean, we've been able to accomplish so much because everyone has been following the guidelines. And so it's just been incredible to see the progress that's been made. And so it's really important that we stay on top of everything and remember, you know, what has gotten us to this place, including the face coverings, the masks, the physical distancing, you know, all of those measures. That's what's going to continue to keep us, you know, having lower cases. So continue to following it. I'm sure everyone is aware of some of the recent updates at the state level with the governor, how he's announced a regional approach with New York and New Jersey as far as visitors or other people, anyone returning from any of the states that have these higher cases. There's some criteria that they've set at the state to require a quarantine for people returning. So this is an important step to you know, to try to keep the cases down in Connecticut and in our region. So they're looking at states that have either a 10% or higher positivity rate over a 7-day rolling average, you know, for the test, or higher than 10 per 100,000 residents, you know, a test rate. So following that, we continue to increase the testing capacity, working with our partners, the community health centers, the hospital, of course, on testing within our community, all, you know, the healthcare providers. And the big thing right now for the health department is the whole reopening Connecticut and the different phases. As you all know, we're in phase 2 right now. So I just wanted to give you a quick update on how that's going. So we continue to visit the food establishments, both for outdoor dining and indoor dining. As you know, the salons are now open as well, from barber shops to nail salons to tattoo facilities. The gyms, the fitness centers are open, and there's several sectors that are open right now. We found that, you know, the businesses are willing to implement the guidelines, and when we go there and we ask them to do things, they're willing to make changes and to follow them. But it is a huge learning curve for a lot of people. So it's education and enforcement, making sure people are aware of the guidelines, and, you know, they can be very specific. And so that's been our approach. It's education and enforcement. And so we found, you know, there's been some difficulties with people wearing masks in kitchens sometimes because of the heat. So we've been having to remind people of the importance, again, of, you know, distancing and wearing masks. Again, just continuing to push that message for everyone to wear their mask and face covering when they're out in public, and continuing to stay on top of looking at the distances between the tables and establishments, reminding folks about those rules. As far as the pools go, many of the condo pools have actually chosen to remain closed for the season. But for those that are open, some of the pools, like at the beach clubs, we're finding that they're doing a good job and following the rules. Barber shops, we've followed up with them about, you know, about making sure the customers are wearing their face masks, their face coverings, making sure they're not congregating, like if they're waiting for an appointment, making sure they're not doing that. So we continue to follow up. We continue to follow up on complaints. So if anyone has a complaint, they can contact the police department or the health department, and we'll follow up on it. And we try to continue to be proactive in the enforcement as well, to be available at different times. And again, education is important. So those are my updates from the health department. I don't know if we want to go into Michelle and then ask questions, or I don't know how you want to. Nick, should Michelle go next, or?
Yeah, unless there's any objections. Did anyone have any immediate questions for the Deanna's presentation? Okay, so thank you. Michelle, would you like to continue?
Sure. So we continue to have our biweekly EOC meetings. And again, the benefit of that is it does bring together a lot of the departments for updates that normally might not be involved. I know we've had some discussions with the tax collector and Parks and Rec on, expanding the tax collection piece. A lot of them are actually looking ahead already to what may happen in the fall, and really looking at some of the contingency plans. Again, the tax collector especially, knowing that may be the busiest season. She's already looking at, additional window space. What can they do to meet the needs of the community? So many of them are kind of looking at that continuity planning and what may happen come fall. We are working with the school district on graduation plans. So they are looking at a drive-through model. We've had a couple meetings with them already, and we have another one, I believe, next week, just to try to solidify what those plans might look like for, I believe it's an August graduation. The state PPE program for small businesses has ended, but we still have some calling in. And then a lot of the churches and some of the other nonprofits are still making requests. So we've been very fortunate with the number of donations. So what we've been able to do is, as those calls come in, for the most part, I've been able to meet all of those needs with what I have. Also put away a small stash of supplies for the disaster shelter trailer in case we do have a hurricane or other tropical storm in the fall. We'll have some PPE supplies, and then also making sure we have a good supply. Should we have another round, we'll have the PPE that we need. So again, being able to balance the request, and then again, looking forward to what may happen down the road. Some ongoing recovery planning with the state and the region. So that will go on.
Excuse me, Michelle, can I ask you a question before we,
Sure.
What are we doing with the camps that are gonna soon go online? I know we have some city camps that are gonna start, and we also have some private ones that are interested in starting. Do we have a concern about that, or how do
Actually,
we plan on dealing with it?
yeah, Deanna, do you want to take that?
In terms of PPE, George, or?
PPE, and are we gonna have to, are you guys gonna have somebody go out there and just make sure everyone's following? It's gonna be hard. I understand the concept and the importance of starting these camps, obviously, especially for working parents that need this so that they can go to work and their kids are occupied. But how are we gonna be able to, for the lack of a better word, police little kids, making sure they're wearing masks, making sure that everything's getting sterilized or cleaned after they're, obviously they're going to be playing with something. They're not just going to sit there and stare at each other. I know you guys have been working diligently, and you guys have done a great job, even with all the emails. I get it through the restaurant, I get it through the salon. I see you guys are on top of it and very informative and give great advice. What are our plans though with the summer camps? That's kind of a scary concept.
So the Office of Early Childhood is that at the state is actually the one that is responsible for regulating and like permitting, the private camps. So I would think they're going to be the one that would be responsible for overseeing the different programs that are running, privately. I haven't, but that's something, I can ask the state health department. We have our weekly calls. We have 2 of them a week. I can ask them, if they can give us more details on that, what that process is going to look like.
Do you guys have any concerns that you would like us to assist with, or?
I mean, so far we've not received any requests for PPE. I mean, I do have some, but my worry is kids are going to be playing. So the surgical masks for the most part, especially if they're kids. So I can't imagine a mask lasting more than a day with little ones. So I don't know if, again, do we encourage them to get some cloth masks or something a little bit more durable, or make sure that the kids are bringing in something from home that can be washed and reused? Because I mean, I don't think we have enough PPE for any kind of summer programs where they'd be using 1 or 2 a day with their activities. So I'd be a little bit concerned about that. But so far, we've not received any requests or outreach from the groups. But we'll keep on top.
On that question, this is David Huvelman. Just, do we have numbers of people that have actually signed up for any of these camps? Is there any hard data of who's actually going to be attending? How many, in case we get into a PPE issue?
We can ask the Office of Early Childhood for that info. They would have it.
And as far as like the city-run ones go, Dave, just so you know, Parks and Recs handles that now, so they would be able to give you a number. I don't know how exact it would be, but they'd be able to give you a number of what the city-based camps attendance is going to look like. As far as the private ones, obviously, we don't have any information from them until the camp start. I think
even with the city-based ones, just the question that you're talking about right now is quantity of PPE. You know, I'm looking at people who can't afford to go out and get their own. Are we supplying for the city camps those people with PPE? Is that the plan?
Oh, and we can check with Nick. Again, they've been very good about being able to get PPE for a lot of their programs, but I'll double check with him and see what they're looking at as far as preparedness. Because like I said, I would worry about the supply that we have, giving all of those to Parks and Rec. We have given them a substantial amount already for the beaches. But again, with kids just running around, I think they would just go through, again, a good supply within a number of days. But we can reach out to Nick and see what their communication has been with the families, and also, again, what they may be purchasing or looking to purchase for PPE.
Thanks.
Yeah, anything that you could find, if you could circulate that with the group, I think everyone would be interested. So I appreciate that, because there's 2 concerns that have been coming up, and one is the camps and, you know, what the kids are going to be doing throughout the course of the summer, and then the recently and unrelated to COVID, just the fireworks as of late. So those are the questions we've been fielding. I'm sure everyone's been getting those questions. So. And while we're on the topic of fireworks, this is just informational purposes only. We are responding to fireworks, and it's the 203-854-3000 number. So if you want to provide that to anybody who's inquiring about, you know, who's enforcing those fireworks and so forth, it's still contraband. And Mr. Keegan brought that up earlier, so we can thank him for making sure that we had some confirmation on that. So with that, can we go back to Ms. DeLuca? Was there any other questions on the camps as we stand? All right, Michelle, would you like to?
I'm sorry, Nick, if I could ask a question. This just jumps back for Deanna or Michelle, I'm not sure who, but are we going to be affected by the Fed pulling out with the drive-through testing, pulling out their funding from that? Is that going to affect Connecticut and the ability to continue the testing program?
So in terms of, like the community health centers, I haven't heard anything specific to Connecticut and its impacts on us right now. So I can't really answer that right now. But I haven't heard anything in terms of that impacting us.
Okay, thank you. And I had one other question is, have they determined how they're monitoring this movement from an area that's affected coming into Connecticut? How is that going to be monitored? How are we going to monitor a quarantine? How is that being implemented?
So it's a voluntary process. So we're not going to have, there's going to be signage, there's going to be communication, but there isn't, as far as I know, there isn't an expectation that the local health departments will be following up with each of these individuals to ensure it's a voluntary basis. Dominique has her hand.
Thanks, Nick. Thanks, Deanna. To follow up on David's question, I read, I believe this is going to be happening, or it was discussed to potentially be happening, where Connecticut troopers are going to be pulling over potentially cars with out-of-state plates, particularly from Florida, to potentially to ask folks if they're quarantining or if they're on their way to a quarantine. I don't know if you can substantiate this. This is something I've heard people say. And if so, is that going to happen with our local PD, where they're going to be expected to do this as well? I mean, I guess I'm looking for clarification because I don't know if that's true or not.
I haven't heard that. I don't know if Michelle, if you have, or DC Zecca, I don't know if.
No, I have not heard that, and we in Norwalk would not plan to do that.
Deputy Chief Zecca's still on the line. I think she could kind of answer that. I know what I heard, and she could go a little further with it. We have a lot of residents that have New York plates, so it's going to be hard to determine which ones live here and which ones are really from New York or even another state for that matter. But I know Deputy Chief Zecca's on the line, and she could probably answer that question a little bit more.
Yeah, Deputy Chief, I think she was starting to answer. She was just breaking up a little. So.
Oh.
I'm sorry. My internet connection's not very good in my office. We have no plans to be pulling over cars or enforcing that. I have not heard about the state police, but I would not expect that to happen, but I can't say for sure what their plan is.
Thank you very much. I just heard that and didn't know if that was in fact true, so I thought I'd bring it up to see what you all thought. Thank you.
Yeah, I think, again, we've not really seen a lot of guidance yet since the announcement was made yesterday. So hopefully in the next few days, we will start seeing more. Interesting, listening to Governor Cuomo this morning on, I think, CNN, he was talking about, when people come in through airports, collecting their information and then people making phone calls. So it really seems to be all over the map about how states may do this. And I'm not fully sure that, and again, not a criticism, but I'm not entirely sure they've really thought all of this through for what all the implications are going to be at the local level, at the state level, and kind of how to address some of the variations between the state. So I definitely think more will come as it, right, if not over the weekend, but into next week. Hopefully we'll see some more guidance.
I just pulled up the
Same thing.
I just pulled up the state website. They've added a frequently asked questions section to the Connecticut Travel Advisory page. And the first question is, how is this going to be enforced? And the response is, this is an advisory, and we are strongly encouraging visitors in Connecticut to take this step. It will be up to individuals to abide by the advisory.
Thank you. Any other questions on that topic? Michelle, I think we cut you off. Did you have additional information that you wanted to?
I think the only last thing was, and I think I mentioned previously, we're doing with the health department, a summer safety campaign, which we did about 2 years ago. So water bottles with some safety tips. And this year we've included just those reminders about staying 6 feet apart. So again, the added reinforcement of some of the COVID messages. And Teresa was fantastic about double checking the messages and then also making sure everything got translated. We stuffed about 1,000 bottles today, and between the senior services, Meals on Wheels, the community health center, I've got 800 going out the door tomorrow, and I'm not entirely sure about the other 200, but I will work on that on Monday. But again, the idea is really encourage that extreme heat safety and just that reassurance or reinforcement of some of our existing COVID messages. And then as always, preparing for hurricane season. So that's my usual. From June until November, it's just hurricanes. So that's about it.
I'm glad you brought that up. Can you so Michelle provides updates on some of the transitions in policy and so forth. And there is some overlap with the emergency response and preparedness for hurricane season with COVID-19. We made some changes for, the shelters and so forth. You want to discuss any of that, any of those updates, or?
Sure. So like I mentioned before, I have put aside PPE for the shelter, masks, thermometers, sanitizer, wipes, a few other items. Red Cross typically has managed the shelter for us in partnership with the city. So they've provided to 2 shelters in Bridgeport, Stamford, and us a commitment that they'd be the shelter management team for that shelter, for the 4 in the region. We've had some conversations with them about their guidance. And for the most part, I think we will be okay. A big part will be our messaging, really encouraging people, if they are symptomatic, really consider, do they have to evacuate? Do they have friends or family that they can go to? A lot of times, and we saw it with Sandy, people came to the shelter even though they weren't really in a flood zone. They were just worried. So being able to really encourage, those who are in the most high-risk area, encourage them to come to the shelter, but the worried well, really, again, stay home, look at some other accommodations. Part of the Red Cross shelter piece is also looking at hotel accommodation and being able to put people up in hotels. A concern on our end is you have a lot of residents that do have the resources to evacuate. They're going to go to the shelter, the hotels first. Again, if they have the means to, again, leave their home, often they'll go to the shelter, book the rooms. Eversource tends to book large blocks of rooms in advance. And then you also have residents from our neighboring community who also may have some resources. If they're in a flood prone area, again, Darien does not have hotels. Westport, I think, has 1 or 2. So often those residents are going to come to Norwalk. So there is a shortfall. So even though Red Cross has said, we'll look at hotels as an option, I think we really need to take that off the table. It would be great if we can, or if they can put them up in hotels, but we really have to look at our existing disaster shelter. And again, what is some of the swing space? So, couldn't we put families as a family unit, maybe into some of the classrooms and identify some of the other areas in the shelter beyond the gymnasium as shelter space? And I think that really is going to be the way to go. We'll have to adjust our feeding plan, use more of the, what I would call clamshells, the unfortunately styrofoam containers. Food goes in, gets put on a table, the worker steps back. So again, really looking at contact-free delivery of meals as well. Adjusting, do you really need to shower every day when you're in a disaster shelter? Maybe again, space it out. For the most part, the bulk of residents are only in the shelter 1 or 2 days. So we really have to look at, again, do you really need to take a shower while you're in the gymnasium? And look at some of our messaging and some of our policies and maybe have it as a timed, after a couple of days, all right, you got 10 minutes in the shower, and kind of space it out and time it out so you don't have large numbers in the bathrooms, and we do have some time to clean. So we are definitely looking ahead. We do hope to do a disaster exercise either within the city or maybe in the region for specifically on this as a tabletop. And then the state of Florida has a fantastic plan for sheltering and feeding for the dual response of COVID and a hurricane. So I'm looking at some of those materials and how to adapt them. But definitely it is a concern because it changes our entire model of how we shelter for a disaster.
Yeah. So what about, are we going to take temperatures as people come in, or do we have a quarantine protocol for people that might have symptoms, or what would that look like?
So we'll have to look at, so typically when we've had again, a normal shelter, we've had the small gymnasium at Brian McMahon as an area for elderly residents that may have some special needs. I think we'll have to look at another space on another part of the school. And we have a few ideas of what that space may be, so maybe that's an isolation area, but also looking at, if you're showing signs or if you've tested positive, maybe those are the folks that we have go to hotels and not go to the disaster shelter. So if we know we have a finite number of hotel rooms available that the Red Cross can block off, I think, again, we have to look at the prioritization. So if a family says, the parent has been tested positive for COVID, maybe that family unit goes to a hotel and doesn't come to a shelter. But I do have thermometers, batteries, and then we will do logs of temperatures. Anybody coming in, coming out will have their temperature taken. And again, the idea is if they're showing symptoms, we really have to look at some of the messaging of, should they be coming to the disaster shelter? Or can we look at some other resources for them?
Yeah, thank you.
It is definitely, it adds another level of stress. But again, I think a lot of us are thinking about it now. So by the time we get to that point, hopefully we will have some good options. And also looking at some other facilities that we may be able to use beyond Brian McMahon.
That's excellent. Any other questions? Michelle, we should reconsider that zombie apocalypse event to maybe.
That's what I'm thinking. Because what else can go wrong in 2020?
I knew that was coming.
So are there any other questions for Michelle or Deanna or anybody else on the call?
Nick,
No.
I have one other thing I'd like to add if I can. It is COVID related. Can
Absolutely.
I add one other thing?
Yeah,
so we've been experiencing a higher than normal water demand. More people are at home, but we've also, the state has entered into a period of dryness that's coinciding with, higher temperatures. So there's an increased demand on the water systems, both because people are at home, but also because people are irrigating their lawns. And so we're just asking people to be mindful of their water use right now. So we could really use your help to promote that message amongst your constituents, to just be mindful. There isn't a current advisory, there's no current advisory or emergency right now related to the water, but it's really important that we think about conserving the water and really eliminating any non-essential water use right now. So just something to bring to your attention that we could use help with communicating.
Thank you.
Thank you.
All right. No, so those are excellent presentations. I appreciate that. I guess for the next couple months, we could continue the cadence with these various updates in terms of, what's happening around what's happening in Norwalk and what you're aware of around the state. So we really do appreciate that visibility that you've been providing us. And again, thank you for all the work that you've all been doing. It's been very thorough, and I could probably speak for this whole group, but we have a great deal of confidence in everything that you've been doing and what we've seen so far. So highest appreciation and thank you. I guess if we have no other discussion items for this, that concludes the agenda. Would anybody like to make the motion?
I'll make the motion.
Thank you, Lisa. It's a motion to adjourn. All in favor?
Have a good night, everyone.
Have a good night.
Have a good night.
Thank you,
Thank
Michelle.
you all.
Good night.
Good night.
Have a good one.